everyone! So we're here at the Cardinal Santos and we are going to Doctora Catherine Howard and we're gonna take a look at her clinic para makita lang ninyo if you're a first-time pregnant mommy. This is what your clinic is gonna look like if you visit Doctora. Hi, Doc!
Hello.
Hi, Doc! There's a pretty doctor! Doc, we want a tour. A tour of
Ako na lang kunyari si Pauline. So when we come in the door, the patient would see Pauline, my secretary, my sister, and then you will just list up for the day. We're via schedule, so you just need to call her up for the schedule. And then when you see her, she will list you as you come in. And then you'll just wait your turn. She usually texts patients and tell them if it's their turn, if you're eating outside, going to the restaurant, etc.
And then these are like your waiting, like the waiting area. Pwede rin dito sa labas. Yan.
The most important part for a pregnant woman, meron siyang restroom.
Alam mo, yan naman ang the best dito. Kasi yung ibang clinic, ang layo pa nung
outside.
For me,
banyo.
sobrang napuli nung pregnant ako.
This is my examination table. This is where you're seen to check your tummy, or we're going to have our pap smear here, checking our tummy, checking the heartbeat of the baby, etc. Right?
Okay.
And then we enter the clinic, and we talk to you here.
There you
Here, and
go.
then we talk to each other.
So, we'll talk.
We'll do our vital signs, we check your BP, we check your heart rate, etc. And then we ask you questions.
Okay.
That's it.
All right.
Okay, let's begin the interview. Today we're gonna talk about when you get pregnant. Of course, one of the things, the first few things that you look for is your OB-GYN, right? So you want to know who's your
Obstetrician-Gynecologist, OB-GYN, OB, yan.
Ano nga ba, Doc?
Ano nga ba, Doc?
It's obstetrician and gynecologist
Oh, yeah.
kami.
Okay.
2 in 1.
Ayan, dalawa.
And then there would be doctors who would love to just stay with obstetrics and take care of pregnant women. But there are doctors who would like it na gynecology, but they would settle for cancer patients na gynecology. Sa OB naman, there would be those specializing in ultrasound, in perinatology,
Yes,
in fertility. You get what I
right.
mean? So there are different areas in OB-GYN.
So, pag obstetrician is really just for pregnant. I mean,
For
yun ang-
women in general.
Ah, women
Right.
in general.
So anything that will happen to you, whether you're a teenager having difficulty with your menses, dysmenorrhea, so even small kids, I get to see if they have like allergies in that area. Basta pang babae, we need to see them.
Ang galing nga. Ay, sorry. Bagong knowledge yan for me. Kasi
Ako rin eh.
I've always thought na pag sinabi mong OB-GYN, OB-Gyne,
Isa lang yun.
parang laging ang conception mo ay pangbuntis.
As long as you're female, whatever, in the
Concern.
capacity of head to foot, of course, we will have to
Yes.
include the
Kasi
LGBT
even
crowd. They need checkups. They couldn't go anywhere else.
And they're welcome. In
Definitely
the
welcome.
obstetricians welcome them.
Doctors were not supposed to be judgmental
Right.
with regard to your
Yes.
choices, right?
Yep.
So, but definitely, each and every one of us, at whatever our choices are, we need to have checkups. When we see small kids being female, and then minsan may infection, and then if their pedia doctor would have difficulty to take care of them, the mommies would bring them to us.
What, Doc, ano ba yung, where do you start? What's the first thing that you do?
Well, I say hello. Well, good day. And then I have them sit down. Definitely, I ask them what's the checkup for. If they say it's pregnancy, we check their vitals. We check them kung may napagawa na sila mga blood tests, ultrasounds, etc. Because there would be times that the patient would come in
Ready
different
na, no?
trimesters. Others would be ready because they came from another consultant. If it's the first trimester, most often than not, the doctor will check your vital signs. I always ask about symptoms. What did you feel before, during the first trimester?
Right.
Really bad vomiting and nausea and headache and minsan hyperacidity even. And those are very uncomfortable for a patient. Oh, it was so difficult, right? And then even yung choices mong food is different.
May
I tell
favorite
them,
ka or may ayaw ka.
right. So all the time, pag first trimester, I tell them to eat bland. Kasi the more oily, fatty, fried, or spicy food that they eat, all the more that the symptoms come in. We tend to admit you tuloy if you get dehydrated. So sayang, diba? So what we do is pag all the symptoms are in, we proceed to doing a pap smear, especially if the patient hasn't had pap smear. If the pap smear was well, let's say I saw some infection, we treat the infection. If I didn't see much, maybe the checking of the breast is also important. That's part of the gynecologic checkup. So each and every female would need the breast examination if walang nakapa, and then we do some weight.
So manual examination lang yun.
Right.
No? Hindi kailangan ng mga
mammo, ultrasound, unless may naramdaman ako.
Right.
Then I send them for just a breast ultrasound. Send the weighing, because sa akin, very important yung weight. Because I really am quite particular with the
How
weight
much
of my
to gain
patient.
that.
I always require my patients to just have a weight gain of 2 to 4 pounds every month. More than that, I try to see what did you eat yesterday or the last week. If you keep gaining weight, it would also be difficult to lose weight after you deliver. So that's how I am. You should be gaining weight maybe like as little as 20 or 25 pounds, as much as 35 to 40 pounds.
Right.
Lang.
In the totality of the of one's pregnancy.
Yes. And then after 3 months, going the second trimester, we start testing some blood tests, mga CBC, we check for Hep B, we check for syphilis. HIV also, we put it in as a prenatal checkup, and also urinalysis. By 6th month, we try testing for the glucose na.
Yes,
You remember?
I hated that.
I know, but I've been meeting just a few patients lang naman na upon their reading, they would rather not take it. I have to respect what they want. It is more of trusting each other. Kasi okay, the patient doesn't wanna do that, but weight-wise, maganda yung weigh-in niya with
maganda
me.
naman yung ano niya.
And then diet niya is okay. The diabetes sa family, wala
naman,
naman, etc.
right.
Then I would forgo it. Maybe every so often, ipapatest ko na lang ng CBG. So yun yung mahirap. And then by the 3rd trimester, we do an ultrasound by the 5th month, congenital anomaly scan, like having it done to make sure that the baby's perfect. Because any problem with the ultrasound, at least if there's some problem with the heart or the gaining of the weight, we can refer to the right person. On the 3rd trimester, ayan na, feeling heavy na ito. During the 3rd trimester, the possibility of contractions, etc., a lot of back pain. Then I would be asking, I would be teaching some exercises, etc. But what's nice with you, you had really good Pilates. That helped you out, right? Oo. So other than that, as your tummy grows, syempre yung weight nun is going to be really heavy. So there would be pregnancy belts.
Belts yung mga
To just lift it up.
Yes, I had those. That they really help.
And then, habang nagiging heavy siya, we get to check you more. As much as possible, we lessen the period that we ask you for it, because syempre it's also additional expense.
Correct.
But we see na, let's say, upon the testing, you're diabetic, you're hypertensive, those little things, then your doctor would be expecting you to do extra work, like an additional biophysical profile ultrasound. You remember that? A non-stress test, and then we might be sending you to a perinatologist if you're of a certain age. Pansin namin, 36 going up. We've been, for the last 5 years, I've noticed a lot of patients getting pregnant in the 40s.
Are they okay?
They're actually fine. But a lot of those would have some complications about chronic hypertension and also gestational diabetes. Pagkapanganak, wala na, bigla. Alam mo yon, so sobrang normal.
Talaga.
It's really during pregnancy.
So parang, you would say, Doc, higher yung parang chances mo of having gestational diabetes if you get pregnant at around 40.
35 up, actually.
35 up.
Right. So that's why I'm so particular.
35 na ako.
It's alright, but the fact that your first pregnancy was beautiful, I'm really, really hoping that your next pregnancy would be good. Even with you, Rika. Oo. Kasi, like with you, age-wise, kunyari, no? As we get older, my patient was 41 on her first baby. Even when she got pregnant again, we never had a blood pressure problem. We never had an issue. So it's really the weight gain. So by the 9th month, you will be at your heaviest. And during that time, if you were very mabait during your pregnancy, no salt, no sugar, proper diet, no soft drinks, no milk tea. That's so common with people nowadays.
Oh my gosh, milk tea, no!
Kasi I've seen a lot of weight gain with that. And
Yes.
then definitely GDM, gestational diabetes, ang
Oh my gosh,
push mo dyan,
yeah.
especially if you still get pregnant.
Oh.
Now, pagdating mo na 9th month, if maganda yung diet and exercise mo, maganda yung magiging face mo. If you've seen people na, yung sinasabi nila magayong ilong, no? Or
It's
magayong
usually
feet,
because of
it's because of
that.
high salt and high sugar intake.
Okay, so hindi totoo na porket buntis ka ay
Right.
magbabaga ka talaga.
Hindi.
Hindi ako masyadong magana, pregnant ako.
Oo, because your diet was, I remember, you weren't eating meat.
Yeah.
But we had to add additional protein,
Yes.
proteins na not meat.
Yes.
Kasi kulang
Pinaka
din.
lang yung protein ko.
Right.
Yes, I
Yeah,
remember
right.
that.
Kasi
Okay,
kukulangan
mga
ka ng
kaibigan,
vitamins.
usually
Yes.
kasalanan ng lalaki ang lahat. Pero kung lalaki ang anak mo sa loob ng tiyan mo, hindi ibig sabihin siya ang rason kung bakit ka namamaga. Malamang ikaw
No.
yun.
Tumpak mo.
O sige, doktora, since if we're mabait naman sa diet
Yes.
and we're mabait to our bodies while we're pregnant and to our baby, ano naman yung mga red flags to watch out for in the 9 months?
So, during pregnancy, yung 9 months, ang pinaka-worrisome dyan is the spotting. You need to tell your doctor, you need to be seen. Is it a polyp? Is there placenta previa or mababa yung placenta that may be covering the cervix? Those things can cause bleeding, even an admission to give you the proper medicine. Bad, foul-smelling infection, maybe itchy discharge in the vagina. Pag ganon, you may be having an infection. It needs to be treated properly because you may have contractions or pain sa puson that might cause you to miscarry or even deliver early. Painful peeing because that could be UTI,
Basta may
fevers.
sakit,
Right.
magsabi sa doktor.
Oo. But, you know, like when we have patients who text us because of colds, cough, pag viral lang yan
Okay
kasi.
lang.
It's the usual that being pregnant. You increase your water intake, vitamin C, citrus, di ba? But if it's more than that, it's difficult to cough out the phlegm, green na yung phlegm, you have fever, you better tell your doctor. Ayaw naman natin maging bronchitis, laryngitis, or even pneumonia. Pag 9 months, what do you watch out for? Siyempre, we would be expecting na anytime you can deliver. If it happens to you on the 7th and the 8th month, of course, premature baby yan. Kung matuloy. So, what you need to watch out for is for bleeding, vaginal bleeding, watery discharge, contractions that get to be painful,
Okay.
and slow movement ng baby. Low movement, like minimal movement. You know that the baby moves a lot inside your tummy. So if you feel uncomfortable that the baby hasn't moved much, maybe like little bits of nudges, then you have to tell your doctor, we might have to check you. Pinakaayaw namin is if the baby stops moving, the possibility na wala na. And ayaw natin yung feeling na gano'n. Now, if those 4 things happen during 6 months, 7 months, don't wait until it gets worse before you call your doctor. Baka hindi na natin siya masagip. Oo. Or definitely, nursery admission is really, you know, other than financially straining, difficult for a baby, right, NICU. Difficult for a baby to come out premature. The best incubator is still mommy's tummy.
Yes! Sige, so we've gone through the first 9 months. And sometimes it could be a bit too much. You are overwhelming to remember everything that your OB says, your doctor says on the first meeting. So, Doc, paano yun? Pagka, kunwari may mga nakalimutan, ano yung protocol mo for questions?
Usually, I ask a lot of questions with my patient. Nire-lead ko na eh. And then they say, oh nga pala, Doc, ito nararamdaman
Sometimes
ko.
kasi you don't,
You don't remember.
or you don't even take note na it's part pala of your pregnancy.
Right. So, if in case, syempre, we can't really talk to you for an hour. I try to talk to you in 10 to 15 minutes.
Yeah.
Makuha ko na kagad lahat doon and then we're done. If kulang pa and I ask the patient, okay, you might not remember your questions, you might remember them later, write them down, and then we'll talk again on your next checkup.
That is such a good practice. So women, if you're expecting, write down your questions. If you don't remember all in one go, write it down lang. Para naman, you can respect your doctor and at the same time, you don't naman get nobody's answering my questions. You have how many visits in the total number of visits in your entire pregnancy?
Okay, we ask you to come in every month. By 7 months, it's every 2 weeks. By your 9th month, by 37 weeks, it's going to be every week until you deliver. But in between that, If you have some problems and we feel like it's an emergency, we'll have to ask you to go to the delivery room, where in fact, you don't need to pila outside the clinic because you're feeling bad. We need you to be seen right away by the OB on duty. And then they call us up.
Ngayon, we can move on na to labor and delivery. Okay, ano usually nire-remind mo sa patients mo?
Well, a lot of people now read up on a lot of stuff, but there
right.
are a lot of stuff,
It's a
especially in the
different
internet.
time.
It's a
Yeah.
different time. May good and bad
Of
doon. The bad there, they get so traumatized with how a birth happens. To the point, pagdating nila, Doctor, I'm so afraid to deliver. And then biglang they ask for CS. Sabi ko, wait lang. It's not that way. I want it to be a great experience. Most OBs would want it to be a good experience. So what I tell them is, what are your fears? So I make them write it down. What are your expectations? What do you want the hospital to do for you? But I do get patients, Doctora, budget-wise, etc. I'm thinking for having a delivery with a midwife. Oh, that's fine. But let me check your entire pregnancy. Have checkups also with the midwife. But if your pregnancy is, oh my goodness, your BP is going up, I don't think you can be with a midwife. But if budget is a problem, a government hospital would be best for you. You get what I mean? It's not like you have to deliver with me. No. It's more of, you have your checkup with us, and it would really depend on your comfortability with the doctor, how your doctor respects you, because the respect is both ways. I need to respect what you want with your birth. You need to respect me once I see, okay, there's a problem. Your baby has a problem, I need to do cesarean section. Then you have to trust me. And I think yung ngayon, yung gentle birth, it's that we need to be safe. The woman needs to be empowered, right? And then we need to be positive. Now, if ang thoughts mo is puro takot ka, mahirap. When you're afraid with your body, I could see it that there's more pain. But if you accept everything,
Tama yan.
even with your birth, right? The contractions are not painful anymore. It's supposed to be a wave. So I just remember now my last gentle birth delivery last Monday. Oh, what a beautiful thing. Yeah.
Umiiyak ka pa rin, Doc.
Well, sa'yo! Umiyak ako! It was so surreal. I would have to tell you guys, it was so surreal. It was my first time to get to cry after delivery. And I didn't tell her until after, like a week after. But that was so surreal because I found it so beautiful that I kept looking for more patients. Now I say, do you want gentle birthing? I'll help you out.
No, I think, you know what's important? I have to mention this, that Doc, she was very open-minded. Like, literally, when I met Doc, I think she wasn't so knowledgeable pa about gentle birth. Siguro sa loob-loob niya, ano ba pinagsasabi nitong pasyente ko?
I did look it up right away.
I know, pero alam mo kung what made me love her talaga, ito ha. Next week, next meeting, I looked up on water birth sa YouTube. Ang ganda ha, ganyan-ganyan siya. So parang grabe si Doc. For me, ang sobrang life-changing nun for me na siya yung doctor ko. Kasi hindi ko rin ma-achieve yung gusto ko if I didn't have a doctor with an open mind. Totoo yun, Doc. I mean, imagine, here's someone who studied for so many years, worked for so many years. She's the expert here, but still she listened to me as a mom-to-be, diba? And I think that is what really made my birthing experience, the whole of it, my whole pregnancy experience so beautiful.
I really found it really beautiful to the point that I have already put it in my list every time I meet a new pregnant patient that it can happen because it happened with you. Now, let's say in the course of the labor and maybe the delivery, it didn't end up as how we wanted, then there should also be respect there between the patient and the doctor. I am very happy. Although each and every pregnancy I've had, like, and different, no? More than 500 deliveries already. But the thing is, there were births that were unforgettable. And one of those births was yours. To the point that I would even tell my patient, about gentle birthing, unless of course the patient already comes in and talks to it. Do you do gentle birthing? They would say that now. But of course, I have met patients who are very fearful of labor and delivery. Nanginginig pa sila sa takot because they could think na parang this is what the other doctor said, na sobrang painful, delikado, and whatever. But wag kayo matakot, wag kayo magpatakot with anybody, whether it's your mom to tell you to go to this doctor or yung doctor mismo nagsasabi, delikado yan, baka ito mangyari sa'yo, ganito, ganyan. The thing is, if you're not happy with a doctor, a doula, a midwife, etc., you can always look for someone else and see kung saan mabubuo yung loob mo, who you will really trust. Because if you trust the right person, your birth would be the greatest you'll ever have. And then you'll probably be thinking with the second and the third, you won't be traumatized with the first child.
Ako, share ko lang quickly tungkol dyan. Di alam nga ni Dokto ngayon niya lang malala. Hindi, kasi nung una plan ko talaga. Hindi, nung una kasi talaga, plan ko talaga home birth. Only my doula knows this. Hi, Irina. I would always say, Irina, I really want home birth, but I really love Doc Howard. So, paano ba to? So, I would also get some checks, pero hindi madami yun Nagpapa-check up din ako sa mga parang
Birthing center.
But, birthing center. Pero at the end of the day, I think my heart is I really want Dr. Howard to deliver me. So parang I wanted the home birth because I really think maganda rin yung experience ng home birth. And my sister can tell you more about it. I think what really matters at the end of the day is that the people with you during your birth, kailangan sobrang okay kayo, sobrang pinatrust niyo yung isa't isa. Kasi kung hindi, kahit nasa bahay ka o nasa ospital ka, everything can go wrong just because of the wrong relationship.
Right. And so, Doctor, anything that you wanna add? Because we're mostly speaking to first-timers. For a first-timer, what's an encouragement that you could give them?
Don't be afraid. If you have a relationship with your husband, definitely for this to be a great pregnancy for you, you should have a great relationship with God, and then look for a doctor that you will have a great relationship with, because if you trust the doctor and then everything's like positive, so on down the line, if your pregnancy's relaxed, walang stress, happy, you know what will come out? A happy, relaxed, calm baby. Whether mag-normal delivery ka or cesarean section.
And Doc, you've seen this with your patients.
Oh,
I
yes.
mean, this is not just pep talk, but this is something actually seen yourself, right?
Yes. Especially with that one, itong deliveries ko. Cesarean section kasi I've been reading up. Promise, after you, I keep on reading stuff about gentle birthing. Even cesarean section would have gentle birthing.
Yes!
I pulled down, I have the cloth pulled down with mommy. Paglabas ng ulo and the arms, mommy, ito na. Happy birthday, baby! Congratulations, mommy, daddy! Ganun yung feeling ko. I wanted to see it. And then when I see the tears in their eyes, fulfilled. And then pag normal delivery, didn't you do it on all fours, right?
Yes, I did.
Okay. This patient of mine last Monday, we tried that. I told them, you did that. You know how she pushed the baby out? My first time on the side. She was on the side with the leg up. Right. A nurse was holding onto her leg.
Okay.
And then, I told them whenever you feel like it, you like to push, blow through the mouth, etc. Slowly, the baby came out. I didn't rupture the bag, but I could see the bag really distending, the vulva. And then we just let it be. I pricked a little bit of the bag, and then the head came out slowly. And then we gently pulled the baby out until mommy got it. Tataka si mommy, how come my baby's not crying? It's gentle birthing. And then we put the baby ng unang yakap, remember, like skin to skin, and then a little bit of rubbing on the back. And then the pedia just dried her up, etc. But we never removed baby from mommy. The skin to skin contact will really increase the bonding of mommy and the baby. And that usually worked out. Twice I saw her before we discharged her. And I kept on asking, how's your baby, Doctora? She's so happy. She's so relaxed. She would just cry for the food and the poo. And then that's it.
Yeah.
And I would go like, I would want my next baby to be a gentle birth again.
Ayan, so pag mga maghahanap ng gentle birth, ayan, promise, I really highly recommend Dr. Howard. At binayaran ko po siya, ha? Baka akala nyo, hindi ako nagbayad sa kanya. No, I paid her in full. So, really highly recommend her. Oo.
Okay. Actually, I think we have more than enough.
Yeah.
Thank you so much, Doc.
Thank you very much.
Dami nating chika eh.
Yeah.
We love Doc so much.
Yes.